The South San Joaquin Valley encompasses 8 counties: Fresno, Kern, Kings, Madera, Merced, San Joaquin, Stanislaus, and Tulare. The San Joaquin Valley alone accounts for 12.8% of the United States agricultural production and is the primary source for a number of food products nationwide. This billion-dollar industry is the heart of San Joaquin Valley's economy. California is home to more than 2 million undocumented immigrants. In Fresno, there is an estimated 280,745 undocumented individuals that labor in agriculture, construction, and service sectors. The Affordable Care Act excludes these undocumented individuals from accessing affordable health care. These are some of their stories.
It's bad. It's bad for us because, like I say, we don't have any insurance. Nothing you can do. I mean, you be sick, you hurt or something. I mean, you can go to the hospital. You can go to the doctor. That's the first thing that they're asking you. Insurance. You don't have an insurance. They tie your hands. They make you wait. They make you wait, and it's bad. Bad for everybody. You have to be real sick to get attention. But I mean, the bill, I mean, you can afford it. You can afford the bill. It's ridiculous. Serious. It's too much money for sometimes for a pill. It's the same thing like I say. I mean, you can get a prescriptions because you take it in to the pharmacy, and as soon as you go and pick it up, I mean, they're expensive. You can afford it. I got a lot of choices. See, I can get the medicine. I have to go cheap and look for the medicine anywhere. Sometimes natural things, sometimes go the swap meet, go the little store and the corner store and buy whatever you need. It's cheap, and I mean, we sometimes you have to prescription yourself because I mean you can afford the doctor and you can afford the medicine.
No, pues es mal porque pues no tienen nada de, pues sin estar uno documentado, uno sin papeles, no es nadie uno aquí, y luego sin seguranza, pues alguna enfermedad, lo que sea, le hace falta mucho una aseguranza a uno aquí para, pues que lo atiendan o de menos ir a un doctor donde te da uno más o menos que lo puedan atender, ¿ve?
¿Y cómo me siento?
Sí, ¿cómo te
pues,
sientes
pues,
no tener?
Pues se siento, bueno, me siento y se sienten las demás personas estar indocumentados sin papeles porque no agarra uno muchos beneficios y pues tiene uno que estar siempre trabajando para no, pues pagar los biles, renta y también lo de los hijos.
We work the same like everybody. We pay taxes and everything, but I mean, it's bad. It's bad, and I hope somebody fixes this thing.
Pues para mí podría significar mucho porque pues tendría una cosa más segura, más seguridad que pues así no tuviera pendiente que al rato no tuviera donde que me atendiera a los doctores o algo, es mejor.
Pues para mí significaría que si yo tuviera un seguro o una aseguranza, pues significaría mucho porque yo no tendría que sacar de mi dinero, de mi bolsa para ir al doctor cuando yo me siento mal o para comprar una medicina. Yo me sentiría mejor porque pues me cubriría el seguro, yo pienso.
I fall off one time and my back, and the only thing that I can do is sit down and go rest in my house. Why? Because I can go in the hospital and check my back and nothing.
Sí me he lastimado en el trabajo. Ya tiene muchos años que yo me lastimé. Pues no me lastimé, fumigaron en otro rancho y fuimos envenenados. Y apenas tiene como 2 años que me lastimé el pie, me caí, pero pues yo no fui al doctor, así me quedé, pensé que no me iba a afectar, pero sí me afectó un poquito a mi pie. Y así anduve mucho tiempo. Y pues como no tengo seguro ni nada, pues yo tuve que comprar medicina para seguir tomando, pastillas, y hasta la vez sigo comprando.
what I've seen, and that's not just here in Fresno, but it's everywhere in California. A lot of people with diabetes type 2, type 1, especially type 2, they're not getting their proper care. They don't get their medications because they can't afford having all those insulins, the medication, the lancets, all that you need to get to treat diabetes. You can't get it because they have no health insurance and they have other problems to solve like food, rent. So having insurance would help them with those costs.
What happens is our patients need to have primary care. And with primary care, our whole goal is prevention. So with prevention, we can give the vaccines that need to be given. We can actually, control the chronic disease that needs to be controlled. But with lack of health insurance, what ends up happening is, first of all, it becomes a barrier to care. So a lot of our undocumented patients, which we have quite a few of, tend to have a lot of chronic diseases, first of all, and a lot of uncontrolled conditions which need to be treated and addressed. But what ends up happening is when they come to see us, we'll diagnose them, we'll treat them, we'll give them prescriptions, and we'll have to charge them for the visit, which one is difficult for them to come up with the money. And second, then what they'll do is that when they go to the pharmacy and they realize that the medications are quite expensive, it becomes a bigger barrier to care. A lot of our undocumented, immigrant patients have what we call emergency Medi-Cal. With emergency Medi-Cal, it gives them access to emergency services or the ER, and so they tend to start using the ER as their primary care. And so not only does cost go up, but the care is also substandard or second, because all they're doing is they're trying to take care of the acute problem, and then they're kicking them out of the ER. And so what ends up happening creates a vicious cycle where patients access the ER much too readily.
Like I said, diabetes, we have a tremendous amount of population of diabetic patients. We have other people that have been sick for ages but don't have the money or the insurance to go to clinics. And when they come to these special family clinics where they have low income programs, that's when they get treated. But of course, it's been years since they've been sick, so now the problem is 10 times bigger than it was when it first started. Controlling your diabetes, seeing a specialist because there's stomach pain, but you get cured, you get healthy. You don't have to worry about your family being alone if the pain gets bigger and turns out to be something else worse, cancer or other illnesses.
All the advanced complications of diabetes, heart disease, congestive heart failure, cirrhosis of the liver, all these conditions that we have to treat, and actually that use up a lot of our healthcare dollars could be prevented if we had them at an earlier stage of the disease process. And if we educate, with education, we can get them, exercise, we can get them to be healthier. And so what we could do is we could prevent a lot of long-term complications. It's so critical. Healthcare is a right, not a privilege. It really is a right, and it should not be, left up to anyone to just say, okay, these people get health coverage and be able to provide for healthcare, and the other population, which is critical. In California, we have such a large immigrant population, that we need to take care of everyone here so that we can, not only decrease costs, but also improve the quality of patient care, and also decrease the long-term, risks, and have a good quality of life for our patients and for our members, for the residents of California. And so what we need to do is we need to pass this bill so that the care is appropriate and it's actually a right now.